Good evening, everyone. Today we are going to study about experimental epidemiology, which I will be covering under the following contents. Okay, so experimental epidemiology are also known as intervention studies or experimental trials. They are the most commonly used experimental trial is the randomized control trial. Okay, why it is called the most definitive tool for evaluation of clinical research is because when you want to test a theory, the most certain way of doing it is by conducting an experiment. Okay, that is why it is the gold standard for evaluating the effectiveness as well as the side effects of all therapeutic, preventive and other measures, be it pharmaceutical or clinical or public health measures. Okay, now an intervention can be anything. It can be a vaccine, a drug, a new technique, okay, a new a health education model, an educational system, okay, anything can be an intervention. And any intervention when used in a study to compare the effects before and after, or with its presence or without its presence, that study becomes an experimental study. So the definition has some key points. Okay, it is defined as the studies that involve some action, intervention, or manipulation, such as deliberate application or withdrawal of a suspected cause, or changing one variable in the causative chain in the experimental group while making no change in the control group, and then observing and comparing the outcome of the experiment in both groups. So the most important factor here is that the investigator or the researcher is going to create some intervention or manipulation, okay, or he is going to change the variables in such a way that the two groups that you are comparing become different. Okay, that is, you are either going to insert a, a factor, or you're going to remove a factor that you suspect is causing a particular disease. Okay, and then see the effect of inserting a factor or removing the factor. That is manipulation. So these studies are under the direct control of the investigator or researcher, which is in stark contrast to the observational studies, wherein the researcher has no active role to play. He is only there to observe what the conditions are and what is happening. Okay, so this was a question that I have picked up from Dental Pulse. Okay. Now I have inserted a few relevant questions at relevant places. Okay. This is one of them. The type of study in a 10-year fluoride tablet study can also be described as an experimental study. Okay. The answer is experimental study. Whenever you include a medicine or an intervention, here in this case, the 10-year is the time period, fluoride tablet is the intervention. Okay, when you say a 10-year fluoride tablet study, it means that you are going to give fluoride tablet to a population and observe them for 10 years and see the effect. Okay, and then compare it with what was the effect before giving this population with fluoride tablets. Okay, so this type of study falls under experimental study. So the answer here is D. Okay, another question was difference between observational and experimental study is, okay, observational studies are descriptive and analytical studies. Here the answer is all the variables are under the control and can be modified by the operator in an experimental study. Okay, no, descriptive studies do not have a small sample size. Okay, and experimental studies do not require a strong knowledge of statistics. Okay, and analytical studies do not always require sophisticated instruments. Okay, so the answer here is all the variables in an experimental study are under the direct control and they are modified or manipulated by the operator, researcher or investigator. Okay, So these are the types of studies, experimental studies. Okay, first is the randomized control trial or clinical trial, where the unit of study is the patients, or uh, generally it is the patients. Okay, in field trial, the unit of study is healthy people, because a randomized control trial is generally conducted in a very closed settings. Okay, a field trial is not conducted in a closed setting, meaning you don't have you're not bound by any constraints in a field trial. Okay, you go out into the field to conduct a randomized control trial. Okay, community trial, the unit of study is communities. Field, when you expand, or a field trial on a larger scale is a community trial. Okay, so the classification of experimental studies broadly classified into two types: randomized controlled trials and non-randomized or non-experimental trials. Okay, randomized controlled trials are those trials that involve the process of random allocation. We will discuss about that. And non-randomized controlled trials are those that do not have any random allocation process, or randomization is not present in non-randomized experimental trials. In a randomized controlled trial, often referred to as RCT, the patients are enrolled in a study and they are randomly assigned to either a treatment group or intervention group, or a control group. Okay, so you have two groups in randomized controlled trial. Okay, one is the treatment or the intervention group, and the other is the control group. And whoever whatever participants are enrolling in your study, they are all being randomly assigned to one of these two groups. Okay, so these are the basic steps of of conducting a RCT, or a randomized control trial. First thing is, you have to draw up a protocol. Having a protocol is going to help you schedule your experiment. Okay, and understand what resources you need and how much you will need them. Okay, once you draw a protocol, okay, you are going to select the reference and the experimental population. Reference population is the population that your study results are going to directly get generalized to. Okay, experimental population is your study population. Okay, then you are going to randomize the population, and then divide them into treatment or and control groups. Okay, when once you carry the process of random allocation out and divide the participants into treatment and control group, you are going to intervene at that stage. Okay, you are either going to insert a drug, okay, or a vaccine, or whatever it is, whatever you are studying. Okay, you are going to maybe you will teach them something and then see the effect of before and after effect of that particular knowledge. Okay, whatever your intervention may be, you are going to insert it at this stage after the random allocation. Then what you're going to do is, you're going to follow this population up. Okay, and after follow up, you're going to compare, that is assessment of the outcome. So, in the natural sciences, a protocol is a predefined written procedural method in the design and implementation of experiment. Protocol is nothing but what you write, okay, before conducting the study. What you write, in the sense, you have to write down the methodology. Okay, it has to include the aims and objectives of the study, the questions that have to be answered, okay, the criteria of the study, and the control groups, procedure for allocation into study and control groups, okay, sample size, standardization of working procedure, and schedule. Okay, so all these things have to be included in your study protocol. Once a protocol has been evolved, it should be strictly adhered to throughout the study. It is going to act like a guide. Okay, so at the start of the study, you may have decided that, okay, I'm going to study this drug A and going to compare it with this gold standard drug B. Okay, the composition of both is similar except for one factor which is different in, say, drug A. It is a new drug and you want to test it. Okay, so at the start of the study you may just have one variable that you are going to study. Say if, for example, if that drug was helpful in combating hypertension, okay, your new drug, okay, and you are going to compare it with a gold standard, or with a drug that is already in the market, has been used, its side effects are already known, and the doctors everywhere trust that drug. So you are going to compare your drug with this drug. Okay, so at the start of the study, say your objective is just to monitor the blood pressure of the participants at regular intervals. Okay, but if throughout the study, if you see that there are new things coming up, okay, just because you are including new variables in your study doesn't mean that you have to change the design of the study. Okay, what happens is studies that are carried out for a long time, okay, you tend to forget what you originally decided upon. Okay, how much time you're going to give this particular step, how much time you're going to give to your study group. Okay, and how much, what are the variables you are going to measure. Okay, you tend to forget them. So that is why this protocol has to be written beforehand. Okay, then you select the reference and the experimental population. Reference is a target population. Okay, it is the population to which the findings of the trial, if found successful, are applicable to. Okay, that is, you are going to generalize the results of your study to this reference population. Okay, like for example, if you are conducting a study, okay, you want to check if fluoride tablets are more effective in protecting smooth surface of primary teeth. Okay, and you want to check this in 5 or 10 year old, in say 6 year old children. Okay, so your reference population is 6 year old children. Okay, so whatever the results of your study are applicable to 6 year old children. Understood? It is like that. A reference population may be as broad as mankind, or it may be geographically limited or limited to persons of a specific age, sex, occupational, or social groups. Okay, comprise population of a whole city, population of school children, industrial workers, according to the nature of the study. Okay, reference population is your target population. You do not involve the entire population into your study. So what we do, we select a small sample from the reference population so that your study results can be directly applicable to them. Experimental or study population is derived from the reference population. Okay, it is the actual population that is going to participate in your study, and it is ideally chosen randomly from the reference population. Okay, that is what we have different random sampling methods. Okay, there are probability sampling methods and non probability methods. A probability sampling technique or probability sampling method is going to ensure that you choose participants from the reference population randomly. Okay, wherein each and every person in that population has an equal chance of being selected in your study. That is random selection of participants. Okay, don't confuse it with randomization. Random sampling is different from randomization in randomized controlled trials. Okay, if the study population differs from the reference population, it may not be possible to generalize the findings of the study. It is important to choose a stable population whose cooperation is assured to avoid loss to follow up. Okay, now if you do long term studies, it is imperative, or it is obvious that there will be some amount of loss to follow up. Okay, especially if you're doing studies among the elderly. Okay, a lot of them will die because of comorbidities. Okay, because of different health conditions. Okay, a lot of them may migrate to some other places. Okay, a lot of them may not feel like participating in your study anymore. You can't force them. So that is the reason why. Okay, you have to choose a stable population. This is called as laws to follow up. Okay, the criteria for volunteers or participants of the study has to be decided. Okay, you have to give informed consent to the volunteers or the participants have to give informed consent to participate in your study. It is a document, okay, the consent form, that in which you are going to explain everything about your study. You are going to explain why you are doing that study. You are going to explain what that study is actually about, what you are testing. Okay, and then you have to have a declaration from the participant that they voluntarily participate in your study and they are free to withdraw from the study without any force whenever they want. Okay, and then the consent form has to have the signature and the name of the person. Okay, also in that consent form, if you are anticipating, if you're suppose doing a study on a drug and you're anticipating any complications, okay, suppose in your animal experiments and in your laboratory experiments you have seen phase 1 phase 2 trials that there are certain complications that occur. Okay, so in that you in if you know about some complications, you have to mention them in the informed consent form. Okay, that is the possible dangers of the trial have to be mentioned. The person participating in your in your study has to be fully aware of what he is getting into. Okay, he or she should be representative of the reference population, and he should be qualified or eligible for the trial. What do we mean by qualified or eligible? For example, if we are conducting a study on uh, suppose we want to we have a drug that combats anemia. Okay, a person who is not anemic cannot be a part of your study. Okay, if you give suppose you have found out a drug, okay, that is more efficient than the already existing drugs. Okay, you cannot test them on healthy population who is people who are not anemic. Okay, so people who are anemic are your major criteria, so that they are eligible to or qualified to be included in your study. Okay, that's the meaning of should be qualified or eligible. Okay, all the so this is a question. All information must be explained in comprehensible non-medical terms, preferably in the local language, about the diagnosis, nature of treatment, risks involved, prospects of success, and alternative methods of treatment known. This form is the informed consent form. Okay, you are informing the participant about all this, and the participant is consenting to this procedure. Then once you select the experimental population or study population, you are going to select suitable controls. Okay, controls are the people, or control population is that population that is not getting exposed to your intervention under study. Okay, like for example I said people who are anemic. Okay, one group gets your new drug, the other group may not get any drug. Okay, or the other group may be getting some other drug that is treating anemia, it means. Okay, but both the groups, the study and control group, have similar characteristics. Okay, so there are different types of controls: benchmark control, positive control, negative control, and placebo control. Benchmark control is a gold standard. Okay, it is a control that is already commercially available, okay, and is being largely used. It is used to find out whether the attested product is having superior efficacy than the conventionally used product, meaning whether your drug or medicine under study is better than the one that is already present in the market or not. Okay, then there is a positive control. Okay, positive control is an agent that is presently considered to be the best and the most effective available agent. Okay, that is, for example, chlorhexidine mouthwash. Okay, if you ask any dentist who is prescribing mouthwashes, okay, everyone will tell you that chlorhexidine, despite its uh, minimal side effects is the best available mouthwash in the market today. Okay, no mouthwash has come close to beating the efficacy or effectiveness of chlorhexidine mouth rinse. Okay, so this is the best mouth rinse that is available. So whichever study, if you suppose develop a new mouthwash, okay, what you will be testing your mouthwash against will be this control. Okay, the positive control, that is the best available mouthwash is chlorhexidine. So we already know it is very good. So when we compare your mouthwash with that mouthwash and we find your results are better, it goes without saying that your mouthwash is then the you can then claim that the mouthwash that you developed is the best. Okay, then there is negative control. Negative control is an agent without an active drug. Okay, like for example, uh, in a trial assessing effectiveness of 4% tulsi mouth rinse against S mutants, the control group is placed under the same mouth rinse, but that other mouth rinse does not have the active ingredient, that is tulsi. Okay, you want to see whether tulsi is reducing the count of S mutants in a person's mouth or not. Okay, and you are testing it with a mouth rinse that is similar in its entire composition except for the one particular thing that you are studying, that is tulsi. Okay, so in cases or in the experimental group you give mouthwash with tulsi, and in the control group you give mouthwash without tulsi. This is negative control. Then there is a placebo control. Placebo is an inert substance. It is not going to have any effect whatsoever. Okay, it looks the same, it will taste the same, it will smell the same, but the test drug has a very different composition from the placebo. Okay, it's like giving normal saline to a child instead of suppose if you're comparing between two drugs, okay, two medicines, okay, and one the drug that you want to study looks like a capsule. Okay, it is in a capsule form. Okay, then when you use a placebo you can use multivitamins as your control, because that drug is not going to significantly affect your study results, but it will look the same. You can make it look the same as your drug in your study. So these are examples of few controls. Okay, a clinical trial was conducted to assess the effect of herbal chewing gum on S mutants among children in Bangalore city. Okay, so intervention here is herbal chewing gum. Positive control for in this case can be xylitol chewing gum, because xylitol has proven to be effective against dental caries. Okay, that is against S mutants. Placebo control can be only a gum base without any added ingredient, maybe just a flavoring agent and a gum base, like your normal bubble gum. Okay, then negative control will be the same herbal chewing gum without the herbal ingredient that you are studying. Okay, next is the randomization. It must be recognized that persons who agree to participate in a study are likely to differ from those who do not agree. Okay, what it means is, when you are when you include participants in a study, okay, they all have to agree to participate in a study. Okay, they may be given the drug under the study or may not be given the drug under the study. Okay, this also has to be explained to the patient. Okay, in the process of random allocation or randomization, it may so happen that a person may not get the drug under the study. Okay, he may get a placebo or a control drug. Okay, that person has to give consent before he gets taken up in the study. So randomization is a procedure by which the study participants are allocated into study and control groups. Okay, whether they are going to receive an experimental or therapeutic agent or not. Okay, that is the difference between study and control group, isn't it? Then it is an attempt to eliminate bias and to allow for comparability. Randomization is the heart of a randomized control trial. This has been asked in your um, NEET exam numerous times. It will give the greatest confidence that the groups are comparable so that like can be compared with like. Meaning, of all the study participants, you as an investigator cannot choose which person goes into the study group and which person goes into the control group. Okay, you have to allow a computer software or another statistical method to decide which people go into which groups. Okay, so that there is no bias, or so that the study results do not get um, tipped by or biased by your manipulation. Okay, everyone should get an equal chance of getting into the groups. It ensures that the investigator has no control over allocation of participants to either study or control group, thus eliminating the what is known as selection bias. Okay, this is the question. Heart of a control trial is randomization. Randomization is done only after the participant has entered the study, that is, after having been qualified for the trial and has given informed consent to participate in the study. Okay, this was a question asked in AIPG exam. The major purpose of randomization in a clinical trial is to reduce selection bias during allocation to treatment. Okay, suppose there are cancer patients. Okay, and you have developed an experimental drug that is going to reduce the uh, mortality. Okay, or reduce the incidence of cancer. Okay, you have a group of 100 cancer patients, okay, who have consented to participate in your study. All of them, in all fairness, ideally should get a drug that will save their life. But you don't know whether your drug is actually going to save their life or not, because it is a new drug. You don't know the complications, you don't know the side effects, nothing. So to test that, you are going to divide the 100 into study and control groups. Okay, and so that you should not get to choose which participant goes into study and control group. Okay, we as researchers cannot play god. Okay, so that is why randomization is introduced. Okay, you do not know who is into study and who is into control group. Okay, you just know that the study group is getting one drug, the control group is getting a similar looking, feeling, tasting drug, which is not an active drug. Okay, the control group is getting a drug that is similar in every way. Okay, but it is not what you have developed. Okay, that is the heart of a randomized control trial. Okay, so from these 10, you have randomly divided the population into control group and investigational group. So if you see, 9, 8, 5, 7, and 3 are in the control group. Okay, and the rest of them are in the investigation or experimental group. Okay, so another question was, randomized control trial has same characteristics of experimental and control groups. Okay, so what are the methods of randomization? So of course a statistical software is used, but these are the three different methods: simple randomization, block randomization, stratified randomization. Simple randomization is if you have a small sample size, okay, and you just want to simply divide them, then you can flip a coin. Okay, heads is experimental, tails is control, like that. Okay, but the problem with simple random is you can unequally divide the group. Suppose you have 20 participants and you want 10 in experimental, 10 in control group. The number of heads you are going to get if that is more than the number of tails, you will end up with an experimental group that has more participants than your control group. Understood? So that is why simple randomization technique is not generally used. Then there is block randomization. So you have to decide how many, what characteristics you need. Okay, suppose you have 50 males and 50 females. Okay, that is a group of 100, and you want to divide them into that is experiment and control group. Now you know, okay, let's look at the image. 6 fours are fine. So you have 24 people here. Okay. uh, Yeah. And you want to divide them into groups. So you have 12 males and 12 females. Okay. And you want to divide them into experimental and control groups. Okay. So you should have a set pattern in your head first. Okay. You have two groups. Okay. And you should create blocks of the participants, meaning suppose I want in one block I want four participants. Okay, so I will have six blocks, like that. So your block should always be in multiples of your number of groups. I have two groups, study and control. Okay, so I want 2 into 3, that is 6 blocks. Okay, like that. So in the each block you should know what you want. I have 12 males and 12 females, so I want two males and two females in each block. Okay, like that. Okay, so in each block there are two black mannequins and there are two white mannequins, isn't it? Just the order of the black and white mannequins are different. Then you are going to randomize the blocks. Instead of randomizing the people, you're just going to randomize the blocks. That is block randomization. And stratified randomization is similar to block randomization. Here what we do is we divide the entire population into strata. Like for example, you classify them according to their body weight. Okay, you're going to classify them as underweight, normal weight, overweight, and marginal weight, or whatever. Okay, and then from each weight classification, you are going to randomly select into experimental and study group. This is stratified randomization. Once you randomize them, you are going to give the intervention or the manipulation. Okay, you are going to deliberately apply or withdraw a particular factor or causal factor. Okay, it can be a drug or a vaccine or a dietary component or a habit or an educational intervention, whatever. Okay, experimental group is exposed to the procedure under test, okay, which is strictly according to the predetermined protocol. Manipulation is going to create an independent variable like a drug, vaccine, a new procedure, whose effect is then determined by the measurement of the final outcome, which constitutes the dependent variable like survival time, incidence of disease, recovery period. Like, for example, that example I gave about the cancer patients. Okay, here the manipulation is the drug that you have created, okay, to reduce the mortality or death due to cancer. Okay, so that will be your intervention or manipulation that is going to affect the final outcome, that is death due to cancer will be either reduced or not changed because of your drug, but you are expecting it to reduce because of maybe successful animal and in vitro studies. Okay, then next, what you do is you follow up. Examination of experimental and control groups at defined intervals of time is known as follow up. Okay, you don't just give the drug and leave them. Okay, you recall them. You ask them what problems they are facing. You note down what they are going through. Okay, what changes they have noticed. Okay, if you are giving something like, for example, considering the dental scenario, suppose if you are giving a mouth rinse, okay, you are going to record their oral hygiene index at different intervals so that you come to know what is the plaque level, what is the debris level, what is the calculus level. Okay, how is it helping, whether the mouthwash is helping or not. Okay, like that. Okay, that is follow up. Examination should be done in a standard manner with equal intensity under the same circumstances and in the same time frame till the final assessment of the outcome. Meaning, examination for your experimental and your control group should be similar at all intervals. Okay, you can't do oral hygiene index in one in the first follow up and then jump to gingival index in the second follow up. It will make no sense because your because the two indices are different, the findings will be different. You cannot compare apples and oranges. Okay, so that is why everything has to be standardized, everything has to be predetermined in your protocol, and you have to strictly adhere to it. Okay, then the duration of the trial is based on the expectation that significant differences will be demonstrable at a given point in time after the start of the trial. Okay, that is, for example, before you start, okay, you are going to expect maybe in 3 months this is the effect that we may see. Okay, so when you start the trial, you are anticipating the trial to get over within 4 months because you want your last follow up to be at 3 months. This follow up may be short or may require many years depending upon what you are studying. If you are studying some rare disease, okay, chronic disease that cannot that no one knows about, okay, that no one fully understands, it will take a long time for you to realize what is happening in your study. Okay, so if you take a very very common disease like dental caries, okay, and prevention of dental caries, the follow up will not be long. Okay, then there can be attrition or dropout. This is what we discussed earlier about loss to follow up. Okay, this is inevitable because of factors like death, migration, loss of interest. Okay, because they have given informed consent, you cannot force them. Okay, the participation is completely voluntary, they can withdraw at any time they want. Okay, if the attrition is substantial, it may be difficult to generalize the results of the study. Attrition of the population, meaning you started out with 200 people, okay, and say so a few of them are dead and few of them left the town and a few of them are not interested. Okay, and now you are left with only 50 participants. Okay, your sample size, estimated sample size before you started the study was 200, so you gathered 200 participants who willingly participated. But now at the end of the study you are left with data only from 50 participants. Okay, so this is a difficulty. Okay, you cannot generalize the results of these 50 participants to your population because the minimum required sample size to generalize results was 200. Okay, effort should be made to reduce the loss to follow up at any cost. What we do is, if the sample size is 200, we inflate it by 20% because we anticipate loss to follow up and we take more sample than what the sample size estimation is. Okay, once you do the follow up, you are going to assess the outcome. The final step is to assess the outcome in terms of results. Okay, they can be positive results or negative results. Positive results will be benefits of the experimental measure, like if talking about that cancer drug, the positive result would be that your drug actually works and reduces the cancer incidence or reduces the tumor size or reduces or increases the survival time of the patient. Okay, the lifespan of the patient is increased. That will be a positive result. Okay, reduced incidence or severity of the disease, reduced cost to health service or other appropriate outcome in the study and control group is a positive outcome. Okay, negative result is a severity and frequency of side effects and complication, if any, including death. That is, you suppose you are studying some drug that is preventing dental caries. Okay, you have developed a drug that prevents dental caries and you want to test it. Okay, and your trial, suppose instead of the Now you are checking whether the dental caries incidence has reduced, but say the side effects of the drugs are so much that the patients are ending up with severe life threatening diseases. Okay, like maybe some heart condition or some renal condition or anything. It can be anything, or maybe the patient is um, dying due to anaphylaxis or anything. For any reason, the side effects of that particular drug, if it surpasses the actual effect that it was supposed to have, okay, that is a negative result. The incidence of positive or negative results is rigorously compared in between the both two groups, and if there are any differences, they are tested for statistical significance by using different statistical methods. Okay, so now there are different types of randomized control trials. Okay, there is a concurrent parallel study design and a crossover study design. Okay, concurrent parallel study design, like the name suggests, it has two parallel arms. That is, one group is exposed to one specific treatment and other groups, either it is exposed to other benchmark control or it is not exposed to anything. Okay, and you do a follow up of the two groups. Okay, so it is like this. Okay, there are patients, you are randomly assigning them, okay, to treatment and no treatment, that is experimental and control group, and you are observing them over a period of time, and you compare the outcome between the two groups. Okay, so the group that is in the treatment group, experimental group, will always remain in the experimental group till the end of the study, whereas in crossover type of study design, okay, there is something called as carryover effect. Okay, I will just, before I read the slides, I will just explain it to you. Okay, so you have subjects, okay, you randomly assign them to treatment and control group, and then you take the measurement of outcome at the end of this period. That is, your baseline measurement is taken before random allocation, then you randomly assign, and then you check the outcome one. Okay, then you wait. Okay, you give a definite period in, you keep a definite period in between. Okay, and then you reassign the subjects. Okay, those that were in the treatment group will now go into the control group, and those that were in the control group will go into the treatment group. This action is called crossing over of the subjects. Okay, and then before you cross over, you again take baseline measurement and then outcome 2. So what is this washout period? Okay, suppose for example you are testing two mouth washes. Okay, so and you're testing it for a period of 21 days. Okay, so mouthwash A and mouthwash B, okay, you have one in one group and other in the, say chlorhexidine is the other mouthwash. Okay, let's keep it a gold standard. Control group is getting chlorhexidine, and one type of mouthwash A is being given to the experimental group. Okay, before you give the mouthwash, you're going to take the plaque index, you're going to record the gingival index, you're going to see what is the plaque buildup, what is the calculus buildup, how much is the bleeding. Okay, you are going to record all these things, then randomly allocate them and give them the mouth rinse and tell them to use it for 21 days, and you call them back after 21 days. At the end of 21 days, you are going to take the measurements again. That is your outcome 1. Okay, then you don't give them anything. Tell them not to use anything for another, say 21 days. Okay, you tell the patients not to use anything for a period of time, 1 month. Okay, that 1 month is going to make sure that the outcome 1 values are gone back to the baseline values. Okay, you tell them, you follow whatever routine oral hygiene methods you used to use. If you brushed once a day, you brush once a day now for 1 month. Come after 1 month, we will see again. Okay, then that 1 month period which you give to your patients, okay, to so that the values go back to normal or baseline, that is known as the washout period. Okay, after 1 month they come, you record their indices again, and you find that the gingival index values and the plaque index values and the calculus and debris index values are similar to what it was before you gave the intervention at the start. Then at this stage you are going to again give them intervention, but you will cross over the two groups. Now the control group will get the control group in the first phase is now the treatment group. So your mouth rinse will go to this group, and the treatment group in the first phase will now be the control group. So they will get the chlorhexidine mouth rinse, and you follow them up for 21 days, and after 21 days you take their outcome measurements, that is this outcome 2, and then you compare outcome 1 and outcome 2. That will tell you which mouth rinse is better. Okay, like that. Okay, so in this type of study, each patient is his own control. The patients are randomly assigned to a study and control group. The study group receives the treatment under consideration, and control group will receive the alternate treatment or placebo. Then they are observed over a period of time. Then the patients in each groups are taken off their medication, okay, or placebo for a certain amount of time, and this is to eliminate the effect of the medication on that patient. Okay, so that there is no effect once the effect is reduced or eliminated completely, the patients are reallocated. This period that you give to the patient to eliminate the effects of the drug that was given before is known as washout period. Okay, and this carryover of effect that happens, okay, that is, if there is a residual effect in a patient, that is known as carryover effect. The amount of sufficient length of time which separates the study periods to enable the participants to be free of the influence of the intervention previously used by the time they receive the next intervention is known as washout period. So this is a question that was that I found in your pulse. Okay, carryover effect is seen in a crossover study. Okay, it is not seen in a concurrent parallel study, because in concurrent parallel study the groups do not get crossed over. Okay, they remain the same till the end of the study. Okay, and definitely not case control or cohort study. So after this washout period, okay, the two groups are switched. Those who receive the treatment under study are changed to control or or, or placebo, um, and vice versa. So advantages of this study design is all the patients can be assured that at some point during the trial they will receive the drug, that is experimental drug. Okay, this study generally economizes on the number of patients that are required at the expense of time. Meaning, the patients, you don't have to recruit more and more patients. You can just use the same patients, okay, but it will cost you time. This study is not suitable if the drug of interest cures the disease, if the drug is effective only during a certain stage of the disease, if the disease changes radically during the period of time required for the study. Then there are other experimental designs like informal experimental designs, before and after without control design, only after only with control design. Okay, before and after with control design. Okay, completely randomized design, randomized block design, Latin square, factorial designs. These are just different types of randomized control trials. Okay, this is a little high level. Questions from this will not be asked generally. I haven't seen. Okay, so different types of randomized control trials are clinical trials, preventive trials, risk factor trials, cessation experiments, trial of etiological agents, evaluation of health services. Okay, clinical trials are randomized control trials. That is, a clinical trial is a trial that tests a pharmaceutical agent generally, okay, a drug or a vaccine. Preventive trial is a trial that is going to use a preventive therapy, okay, testing a preventive therapy. Okay, a risk factor trial is a trial that manipulates the factors that are in play in the study. Okay, so this was a question that was asked in AIMS exam. Good clinical practice is observed in all phases of clinical trials except for preclinical phase. Okay, now there are different phases: phase 0, phase 1, phase 2, phase 3. Okay, these are the different phases of clinical trial, meaning phase 0 is in vitro studies, then you have animal experiments, then you have healthy experiment on healthy volunteers. Okay, small group of healthy volunteers, say 10 or 20. Then you have volunteers from the community. Okay, then you have a large scale trial. Okay, like that. So there are different phases of clinical trials, and good clinical practice is a guideline that is given for clinical trials. Okay, wherein you are told what are the do's and don'ts of what you can do and what you cannot do, and this is observed in all phases except for preclinical. Any phase that includes a human subject or an animal subject or a living subject. Okay, for any clinical trial that involves a living organism. Okay, good clinical practice guidelines have to be followed. So only in the preclinical trials this criteria is not met, so it is not being followed. Then there are field trials. In contrast to clinical trials, field trials involve people who are healthy but who you think are at risk of developing a particular disease. For example, smokers. Okay, smokers, and if you want to study smoking and cancer, smokers in a particular geographical region will be your participants. Data collection will take place in the field, usually among non-institutionalized people in the general population. Okay, one of the largest field trials was the testing of the Salk vaccine for preventing meningitis, which involved over 1 million children. Of course, the investigator had to go out into the community and test them. Then there are community trials. The treatment groups are communities rather than individuals. So you don't have one particular person who is reacting to your intervention. Okay, you are checking the effect of your intervention on an entire community. Okay, particularly appropriate for diseases that are influenced by social conditions and for which prevention affects target group behavior. Okay, there may be some socio-cultural factors that affect the way a particular community gets affected by diseases. Okay, which can get prevented by preventive or behavioral modification. This is observed only in community trials. Then in randomized control trials, you come across something called as bias. Okay, bias arises because of errors of assessment of outcome. It can be a human error. Okay, there are four sources of bias. One is bias on the part of participants, that is known as subject variation. Then there is observer bias, which is on the part of investigator or researcher. Then there is bias in evaluation and bias due to confounding. Okay, now confounding variable is one that is going to have an effect on both the exposure and the outcome. Okay, so this is a question that I found. Age was found to be a factor affecting the relation of diabetes mellitus and periodontitis. Okay, this type is a confounding bias. Okay, age is associated with both diabetes and periodontitis because age is something that is subjective to a patient. Okay, everybody, all patients are going to have some age, isn't it? So that is a confounding bias. It is seen because as the age advances, diabetes mellitus also increases, incidence of diabetes mellitus increases. So does the incidence of periodontitis. That is what I mean. So bias is any systematic error in determination of association between the exposure and disease. This is the definition of bias. Any systematic error in the determination of association between exposure and the disease. To eliminate bias, we do blinding. Okay, blinding is done to reduce bias in three ways. Okay, there are actually four ways, but generally three ways are sufficient: single blind, double blind, and triple blind trial. So single blind trial may what happens is the participant does not know whether he is in study or control group. Okay, double blind trial may the investigator and the participant does not know who is in study group, who is in control group. Okay, this is done by involving a third person who is just going to randomly allocate. Now that third person does not know what you are testing or who are the participants. He doesn't know anything. He's just going to randomly allocate the participants and go. So the investigator does not know which participant is in control group and which is in the study group. The purpose of double blinding in a clinical trial is to avoid observer and subject bias. Subject bias is from the participant. Observer bias is from the investigator. The double blinding method is going to eliminate both these. Double blind study is the subject and the examiner both do not know the details of the study. Okay. Then there is triple blind, which is one step further. The participant, investigator, and the person analyzing the data are all, when you say are all blind, it means they do not know the details of the study. Okay. Apart from participant and investigator, now you don't tell your statistician who belongs to which group. That is, you remove the paper names of the people from the data sheet. You just give age and whatever you have whatever data you have collected. Then the person analyzing the data, the statistician, will not know. Okay. Then there is quadruple blind, where four of the relevant groups are not aware of the treatment assigned. That is, participants do not know, investigators do not know, investigators who are examining do not know, who are assessing outcomes they also don't know, and the analyst also doesn't know. This is a concept that I've not seen many questions about this, but I just would like to touch on it. Hawthorne effect is an effect that is that creeps into a randomized control trial. Okay, meaning suppose you are observing something, observing a group. Okay, and the patient knows that if he gives a particular type of answer, you will be impressed. Okay, then the participant starts answering in that way. That is Hawthorne effect. That is when people are observed or when they believe that someone cares about them, they behave differently. Okay, when they realize what you want to know, okay, they may start giving answers that suit your cause instead of giving the real answers. That is Hawthorne effect. Then there are non-randomized control trials, where a study where the participants are assigned to the treatment or procedure or intervention group by a method that is not random. Okay, suppose most of the studies are generally not non-randomized control trial. Most of, especially most of the clinical trials. Okay, so non-randomized trials can be controlled or uncontrolled. Uncontrolled means there is no control group. Okay, in controlled trials there are control groups. Okay, for something that is mortal, for a condition that is mortal, if you design a drug, generally the trials are uncontrolled trials. Okay, then there are natural experiments and before and after comparative studies. Okay, in uncontrolled trials you use historical controls. That is, you see records of patients who are affected by the same disease and use them, the details of those studies, as your control reactions, control data for controls. Controls. Then there are natural experiments where experimental studies are not possible in human population. What the researcher will do is they will try to identify the natural circumstances that are going to mimic an experiment. For example, you cannot force people to smoke just to see what effect is it has on the people's lungs. Okay, that is not ethical. So what you do, you already have people who smoke in the community. You just naturally divide them into smokers and non-smokers. Okay, they are natural groups. Okay, you are not creating or adding anything there. It is already present, and you're just going to divide the two into smokers and not smokers, and then you're going to see what effect it has. That is natural experiment. Then before and after comparison studies. Okay, before and after comparison studies can be without control or with control. Same, before and after matlab, you like the mouth rinse example that I gave, baseline data you collect, then you give the drug, then you collect again. That is before and after. Now this is, I have added this because I have seen question about this. Okay, now how do you report clinical trials? Randomized control trials are very specific in the way they are reported matlab, when you are publishing your data, what checklist should it follow, what kind of information should be revealed. Okay, what things you can skip. Okay, that is the reporting of clinical trials. So there is a checklist called the consort statement. Okay, that is consolidated standards for reporting trials. This checklist has 25 items and a flow diagram, and you have to include each, and you have to check each and every item when you are reporting a randomized control trials. Okay, this is when you publish your results. Adherence by the authors to the checklist facilitates clarity, completeness, and transparency. So, if you publish a randomized control trial and you're following consort checklist, okay, if I am a reader or a fellow researcher who is reading your article, I know what you have done and I know how you have done it. So, when I know the transparency of your study, I can rely on your results. Okay, and I can replicate it in the population that I live with. Okay, so this is just a pro tip. That is, it's not a part of the presentation, just a tip. Okay, similar to your consort statement, there are statements for observational studies. Okay, that is for descriptive and analytical studies, case control and cohort studies. That is, you have the strobe statement. Okay, it's called the strobe statement. Okay, for experimental studies, we have the consort statement, and for systematic reviews and meta-analysis, there is a PRISMA statement. So this was a question from your Dental Pulse. Consort statement is applicable for randomized control trials. For cohort, cross-sectional and case control studies, there is strobe statement. So, randomized control trial is considered as gold standard of study designs. Okay, there is a hierarchical pyramid, okay, of different study designs, and randomized control trial is almost at the top. It is at the second number. This is the evidence based hierarchy. This is what I was talking about, the pyramid of evidence based hierarchy. So at the bottom you have ideas, opinions and editorials, okay, that have no valid or scientific backing at all. It is an opinion. I think a drug works. What proof do I have? I have no proof. It is my opinion that a particular drug works. Okay, but this world doesn't run on opinions. So this evidence based hierarchy is going to tell you how much to believe on the literature you are reading. Okay, then after opinions, there is case series and case reports. Okay, then there are cross sectional studies, case control studies, cohort studies. At the second most level, there is randomized control trials, and at the topmost level, there is systematic reviews and meta analysis. Why I am showing you this is because there was a question that was asked. According to hierarchy of evidence for scientific literature, randomized control trials are level 1, 2, 3, 4. The evidence level of randomized control trials is level 2. Okay, level 1 is systematic reviews and meta analysis, level 2 is randomized control trials, level 3 is cohort studies, level 4 is case control studies, 5 is cross sectional studies, 6 is case reports, and at the bottom, level 7 is ideas, opinions, editorials, anecdotes. Okay, I'm open to questions. Are there any questions? You can ask me if you haven't understood something or if you need clarification of something.